The advice and opinions expressed by the host of Autism Live and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice. Any choices you make in determining your child's treatment are completely at your own discretion.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Good morning and welcome to Ask Dr. Doreen on the Autism Network. I'm Shannon Penrod and I'm here with the fabulous and stunning Dr. Doreen Granpeesheh.
Good morning
and welcome.
Thank you very much. Good morning.
If this is your first time watching and you don't know Dr. Doreen, let me fill you in that she is a true expert in the field of autism. She's been working in this field for more than 40 years with great success. There are so many of us that feel that we owe really our lives and our children's lives to her, myself included. And she is here once a week. She donates this hour to answer questions that you guys write in from all over the world. The other thing that I always like to tell about you is that I say in the beginning that you're a visionary, and I believe that that's true. But not just a visionary, someone who's a compassionate visionary, that you're always looking at individuals as individuals. So many people take a big paintbrush and go autism and assume that everybody is the same. And you not only look at each individual on the spectrum as an individual and what their needs are, but you also look at the people who are the supporting actors around that individual and are concerned about all of them and what they need to be able to support this individual. So thank you.
Thank you. And that's so important to do that, to make sure the whole family system is okay.
Yes, yes.
Yeah.
But a lot of people focus on different parts. I don't hear enough people following in your tiny little shoes just to like put it all together and look at that person as an individual with individual needs, and how can we set them up for success by helping with their family unit to make that happen.
Right.
But you've been doing that for more than 40 years, thank God.
Thank you.
Yes, because my family greatly benefited from that. And now you guys can too, because you can write in your questions right now. We're live right now on Facebook, YouTube, Twitter, and about a dozen other sites. Our really remarkable Traven is going to show you some of the places that you can connect with us any second now. I do want to say, because sometimes people write and go, is this live or whatever? So this is the morning of, it's Tuesday, January 31st, 2023. I keep getting the year, I'm like, is it 22? Is it 23? Are we 21?
I've said 2013 multiple places. I bought something and they put 2013 on there because that's what I said.
Oh my gosh, yeah. No, it's 2023. That still doesn't roll. And it's the last day of January. Welcome February.
Thank God.
Yeah, can we shove January into the ocean?
I'm telling you, like I'm with you there completely.
January is like so long and so brutal. I have no right to say that because we live in California, but it's been cold. And our houses aren't built for cold, and I can't handle it. I moved away from the cold because I can't handle it. Yes, I am a wuss. I'm officially a wuss, but I cannot handle it. So anyway, and because of that, we have forced heat everywhere, and so
Yes, we do.
and it's warm in the studio this morning. So if you see me start to fan myself, it's not just menopause; it's menopause plus. Okay, so keeping it real, we're here for this hour to answer your questions. I also want to say, and Traven is showing you all the places that you can watch or listen. This show is available as a podcast as well. If you are just tuning in or you've been watching and you're like, oh, I wish I knew what Dr. Granpeesheh had to say about this, it's really easy. You can look back at 12 years of what Dr. Granpeesheh has had to say about everything. You either can go on our YouTube channel and go to the Ask Dr. Doreen playlist, and at the start of all of the videos, it shows you what the question is, and you can click on it and fast forward to exactly that question, or you can go on our website, autismnetwork.com, and go to Ask Dr. Doreen in topics and just type in whichever topic you want, and it will show you all the questions that she has answered on that topic. So you can get super duper specific. So I hope that you will do that. Please remember to like, share, review, tell other friends, because we appreciate that. Also want to let you know we have a Patreon account now for Autism Network if you want to keep the show going. And you're going to start, when you're on YouTube and other places, you're going to start to see more ads because we need to keep the lights on. So please patronize us and skip when you want to skip, watch when you want to watch, do what you want to do, but know that that's so that we can bring this information to you for free. That's how we're keeping the lights on. So we always have a topic now for Ask Dr. Doreen, that we start with a topic and a question to kind of kick things off, but we'll take questions on any subject once we address that topic. So today's topic is, what is the difference between autism and intellectual disability? Because, Dr. Doreen, so often people still, 2023, and people are still making the assumption that one means the other.
Right.
And it doesn't. So talk to us a little bit about this.
So they are completely different and not related. So let's just start there. Intellectual disability just means that the individual has a lower than average IQ, or intelligence quotient. And the way that you measure that is through IQ testing. And there are a number of different types of IQ tests, and so viewers will be familiar with the names of some of these. The Stanford-Binet is one that goes across multiple ages. The Wechsler tests, which are very well known, and there are multiple different ones. If you are I believe, between the ages of 2 and 6, then you're given a Wechsler test called the WIPSI, which stands for Wechsler.
It sounds like a lawn sprayer for your kids to
Exactly.
the WIPSI.
The WIPSI.
Right.
That's for 2 to 6, and then the next one is the WISC, which is like from, I think, 6 to, I'm not sure, 11 or something. And then the next one is, or maybe even 6 to 16, and then the next one is the WACE, which is for adults. And these are all Wechsler IQ tests. And then there are also nonverbal IQ tests, like the Merrill-Palmer or the LIDAR-R. And in essence, these tests are supposed to be measuring cognitive ability or intelligence, right? And in order to actually receive a diagnosis of intellectual disability, you have to and so their intellectual disability means that you are below average IQ, and how far below establishes the level of intellectual disability. So average IQ, most of us have an IQ of about 100. And the way that IQ is measured is it's a fraction, and it's your mental age divided by your chronological age times 100. That's how you get IQ. So if your mental age is let's say, my mental age would be 60, and my chronological age is 60. 60 divided by 60 is 1, times 100 equals 100. So my average IQ is 100. And most of us, that means that your mental age, your cognitive abilities have increased every year that you have aged or have become, they've grown at the same level, let's put it that way. And so your average IQ is always 100. Now, because there's a big difference in people, there's this thing called a standard deviation, which means that like 98.9% of people will be within 15 points of that 100. Okay, so most people will be like 1 standard deviation below or 1 standard deviation above. So they'll either be 85 or 115. So somewhere between 85 and 115 are most people, okay? But there are some people who are below that even more, or above that even more. So that would be someone who is 2 standard deviations below, so their IQ is around 70, or 2 standard deviations above, so their IQ is 130. And if you're 2 standard deviations above, you're highly intelligent, and that's, gifted.
Yeah.
And if you're 2 or more standard deviations below, then you have intellectual disability. And as I said, they go by different levels. So there's like borderline intellectual disability all the way to profound intellectual disability, and there's multiple levels. Now, so that's kind of how you measure ID, intellectual disability.
Okay.
Which, in the old days used to be called mental retardation. It's the same basic concept.
Right.
Now let's put that aside for a minute, and that that could apply to just anyone whose intelligence or intelligence quotient is below average.
Okay.
Now, autism has absolutely nothing to do with that. Autism is diagnosed completely differently. You do not do a test of intellectual ability for a diagnosis of autism. You're looking at completely different areas for autism. With autism, you're looking at two areas. One area of functioning is called social communication, and the other area is just repetitive, stereotypical behaviors. So in the social communication area, you're essentially asking about and observing specific symptoms. Like, for instance, the individual doesn't give good eye contact. The individual does not have vocal communication. The individual doesn't know how to interact socially with other people. Those types of things. And you have to have a certain number of symptoms in that area. And in the second part, which is the kind of stereotypical repetitive behaviors, you have things that are like, and many people who have a child with autism will recognize these, and they're very different, right? The stereotypies can be anything from lining up objects to, repetitive repetition of a vocal sound, to visual gazing, to the need to touch textures. I mean, there's a bunch of different behaviors, Shannon, that we all refer to as self-stimulatory behaviors or stereotypy. Even the sensory stuff falls into this category now, having sensory dysregulation. And so if you have those two areas are affected in the child, so you have, some issues with social communication and some issues with those kind of stereotypical behaviors. If you have enough symptoms together, then you will get a diagnosis of autism or autistic disorder. Now, you could also have a diagnosis of intellectual disability, but it is a completely separate thing. And the problem is that when you have a deficit with social communication, when you have difficulty understanding language, and remember with ID, you have to do those tests.
Right.
And most of those tests, the Wechsler test and the Stanford-Binet test, the most worldwide recognized tests, are verbal in nature. So they ask questions or they tell you to do things using language. So, put this there, or, imitate this, or reproduce this pattern, or what is this, or those types of things. And if you have a deficit in language, if your language is delayed, which, as we know in autism, many children, due to their sensory issues, their language is delayed. And so then you will have a very hard time understanding what you're supposed to do or what is being requested of you. So it becomes almost very, very difficult to measure your raw intelligence. It's kind of like taking a nonverbal child and giving them an eye exam. If they don't know what you're asking, they're not going to be able to respond to you, so you won't know if they're actually seeing those things, right?
Yeah.
So that's the problem. So therefore, a lot of people assume because kids with autism will actually do worse on IQ tests, so because they're not understanding what's being asked of them, they have attention issues, all these other things that are interfering with the examiner's ability to actually measure the raw IQ. So a lot of people assume that kids with autism will have low IQ or intellectual disability. And I've had cases where a regular IQ test will actually show like an IQ of, 70 or 65. And then when you give the child under very good circumstances a nonverbal IQ test, like a test that is designed for deaf children, and the child is able to attend, then there's like a 30-point difference, and the child is actually responding with normal IQ levels, right?
Yeah.
And that's super important. I always tell people to pay attention to that because, and I'm rambling now, but there's a lot of stuff that goes with, when you have a child with autism, you have to continue to try and teach them as many skills, or at least I believe you want to teach them as many skills as you possibly can so that they thrive in society, so that they are able to use their own skills and the ones that you taught them to do really well in life. And if you have a diagnosis of ID, a lot of times people just kind of give up. and they assume that your child is not able to learn, and they make excuses and all that sort of stuff. And then, and honestly, if you make an assumption that someone is not able to learn, and you don't attempt to teach them things that are important and adaptive and functional for them, they won't learn. There's nothing for them to do, and they will fall behind in society. And so that, to me, is very important to differentiate. It's a really important thing for those on the spectrum.
I think you've really hit on something really important, because I think for a lot of autism parents, we struggle with the idea of, when am I pushing them too far?
Yeah.
Like, am I asking them to learn something that they're not capable of
Right,
learning?
right.
And I think that's where the giving up comes from.
Right.
But I know many parents whose children were diagnosed as ID along with autism, and the school parked them in a
Yeah.
classroom where they were going to play with crayons for the next 10 years.
Yep.
And then later on, somebody just inadvertently, you know, talks about something with the child, not knowing this preconceived notion of apparently they're not capable of that.
Right.
And then we see this ability flourish in this child, and the parents go, oh my gosh, what did I just do?
Yeah. That
I let them be parked for 10 years. It's hard, but a couple of things I heard you say is that if we are having our kids on the spectrum do a IQ test, and our kids are nonverbal, we should ask for them to have a nonverbal test.
Yes.
And
that doesn't always work, too.
Okay.
And that, I mean, it does, a lot of times it works, but sometimes it doesn't, just because our kids have a lot of visual input issues, auditory input issues, and also distractibility, right? So they can't pay attention. And just the visual input stuff itself is so important. Like, you know, so many of my kids, the very first thing I notice is that their eye contact is fleeting, right? So they're like, they're visual, they're just, it's as if the whole time they're trying to establish the box around them, right? So their eye contact is everywhere. And when you're doing that, it's very, very hard to focus on one visual thing in front of you. I mean, I know Temple talks about the visual field a lot. And that is, I think, vital to how they learn and how they understand. And so a lot of these nonverbal IQ tests have a very big visual function, right?
Yeah.
You have to pay attention to things that you see.
okay, so maybe the takeaway is that especially when our children are young, that we should not be tied to whatever the result is. If our kids are on the spectrum, don't be tied to what the IQ tests are. Push for our kids to be able to learn.
Absolutely.
Now, on the flip, though, I do have people that I know who wholeheartedly listen to that and go, okay, they told me my child had autism and an intellectual disability, and I reject that. And we're going to push, we're going to do as much as possible. But now the kids are older, and it has become evident that the progress is not there.
Yes.
And they don't want to let go of it.
Yeah, that's also very hard because, you know, it's almost like you're pushing the child too far, and it's also very difficult for the child because they are experiencing failure.
Yeah.
And it's also very, very hard for the family unit, right? Because it's disappointing every day. So yeah, we have to have a very realistic point of view, and that's very difficult to do when it's our own child. And from my perspective, IQ does, at some point, it becomes interesting and important. It teaches you a lot about the child.
Yeah.
But I think that initially, like a lot of people, when they first get the diagnosis, at that point, I'm not too concerned about getting an IQ score right away.
Okay.
For me, in the beginning, the first year, like assuming the child is around 3, the first year should be kind of a year where you're learning about the child's learning style, and you're getting to see how rapidly the child can learn. And so as a clinician, BCBAs should be kind of experimenting and making sure that the child is progressing all the time, and if they're not progressing, you have to change what you're doing. So like this is, as you know, Shannon, like one of the things we used to do is we often would just change things around and identify, wait, is he having a hard time because the stimuli that I'm using are too small, too far, too confusing, or should I be using more visuals, more verbals? we change the modality of how we're teaching, and we never assume that it's because of the child. We assume that it's because of the style of therapy or the way that I'm teaching. And you do that a lot for the first year, because then you learn, okay, there is a way to teach. Now, that being said, I remember I used to have a child, a little boy. We did so many different things with him to try to get him to pay attention and learn. And honestly, it wasn't until we realized he actually had very significant hearing deficit, right? And it was very, very hard for him to learn. And so you always have to think of all these different things. Is his hearing intact?
Yes.
Is the vision, and it's not just standard vision, it's all these aspects of our visual ability, like being able to, binocularity, being able to focus both eyes on the same stimulus, being able to track, being able to do figure ground discrimination. These are things we do and we don't even realize it.
Yeah.
And our kids have a very hard time with some of these things, both from a visual perspective and auditory. Sometimes
I was just going to say, auditory.
Exactly. They can't determine what is being said because background noise is too loud. These types of things are super important before we make any conclusions about their intellectual abilities.
Yeah, the English language is such a tough language to hear, and we have so many diphthongs and triphthongs, and there's a whole section, in fact, in skills that in a very interesting place where it teaches about auditory discrimination, to be able to discriminate what a diphthong is and what a triphthong is, so that you can hear the sounds to be able to understand what somebody is saying. And we've seen a couple of different cases of especially nonverbal women who get to a certain age and then now are able to do it and have said, like Carly Fleischman said, I wasn't able to decode what you were saying until she was like 12.
Amazing.
Isn't that amazing?
Amazing.
So interesting. But I guess my last question is, so IQ can change? Because we were told for decades that it could not.
Yes. So actually, I remember when I was working with Lovas, at UCLA years and years ago, he had written about this, and he called it the malleability of IQ. Because IQ does change, obviously, because it's funny when you do the very first time, if anyone who's a psychologist or has been tested for IQ, you know that if you just memorize vocabulary, your IQ score will go up. Because the tests, those IQ tests, are assuming that you're not specifically sitting there and prepping for an IQ test, And so, but very truthfully, if you have higher vocabulary, you're going to score higher IQ. So it's very easy things like that you can. So over time, if a child is learning more, which obviously, let's say you're in an intensive ABA program, your child's going to be learning more. So the IQ test will change. And obviously, as you know, I've published a paper on this where we had children who at the beginning of intervention, their IQ was in the 60s or 70s. We did 2 or 3 years of intervention and their IQs went into the 100 range. And so that's a very important distinction as well.
That was our case. The first time that our son was tested, they came back and said we couldn't get a score. We couldn't. He didn't have enough language for us to test him. And then the next time, I remember it was within the range where we were concerned about was there going to be intellectual disability. And then the year after that, his score was so high.
Yep.
And I remember being disappointed. It was like a 139 or a 140, and I was disappointed. And the person who was giving me the results said, I don't understand why you're not excited. And I said, I really wanted him to be in Mensa, and Mensa, it has to be 150. And she was like, no, in this test, the highest score is like a 142, something like that. I don't remember what the numbers were. And I was like, oh, okay. But she was like, you should be happy. You should be thrilled.
Yeah.
And I am. And that's not everybody's story, and I have to cling to that. Okay, so, but we did have somebody write in a question that had to do with this. Melissa, and by the way, I'm saying hi to Amna and to Susie. Melissa has written in and said, my grandson was diagnosed with autism around 18 months old. They said he would never speak. He will be 4 years old next week, and not only does he speak, we just discovered that he can read. Should we have him retested? I believe that he has hyperlexia too.
Yeah. So I love that question, and congratulations. I love it when you suddenly discover that a child has taught themselves to read. It's so beautiful, that moment. Hyperlexia is great. Yes, you should have him retested. And I mean, honestly, guys, I think that it's not a bad idea to have some form of retesting done annually. And I know it's a lot.
Will insurance pay for that now? I don't know. I literally don't know.
It depends on the testing.
Okay.
So for instance, insurance may not, it depends on the diagnosis. So let's start there. So if you have a diagnosis of autism, yes, you should be able to get autism diagnostic testing every year, and insurance will pay for it.
Okay.
If you have a diagnosis of intellectual disability, you should be able to get IQ testing every year. It depends, because what the whole purpose is, we're trying to show if that diagnosis still applies or if you've kind of overcome it, right? And so that is really important. But now, hyperlexia, the ability to, the advanced ability to decipher letters and be able to read has somewhat of a correlation with autism. There are children who do have hyperlexia, and I love it because I have found that kids, and there's published material on this, that kids who have hyperlexia actually tend to do very, very well. They have a higher tendency to lose the diagnosis of autism just because now they have a kind of third way, I guess, of learning. One way being just visual, iconic, just like pictures, and the second one being auditory, and now they're reading. And so when they are, let's say, have a difficult time with social communication, a lot of times we can give them what they are supposed to be responding and what they're supposed to be asking. We can teach that to them in the form of writing. They can now read books that will advance them faster. They will be able to, they generally tend to go faster, right? And so it's wonderful, and it's a really nice thing, and I think it will help his auditory. It will help his vocal. And so, yeah, I would get him retested, and why don't you just have him, have them test for his IQ, have them test for diagnostic. And, you know, the tests that I think are important, and this is not just for this little child, but for all kids, are the tests that specifically measure the areas that we feel need help. So if your child is delayed in language, I'd be doing language testing every year. If your child has motor skill deficits, I would be doing those types of tests every year, because I want to see what is going on, right? And if your child's having a hard time, like if your child's having a really hard time just learning, I would do some neuropsych testing, and also that would apply also to kids who've done very well, but they're caught on like the abstract stuff. Neuropsych testing gives us a lot of information about things like how your child memorizes, how your child patterns his universe, like what types of patterns does he learn. What are difficult things for him? What are easy things for him? And so on.
I also feel like when we talk about kids who have hyperlexia, it seems like from hearing you talk about this for years that I always want to say for those kids, we want to make sure that we're keeping them with enough stuff so that they're not bored and that they're stimulated, because I feel like the kids who get that level, they have a place to take all that energy and drive it, and if they don't, that they have problems with anxiety later on. Is that accurate?
I don't know that, not necessarily anxiety, but I would say for all of our kids, and I'm really glad you brought that up, because it's not just hyperlexic kids, it's also just, you know, you have kids with autism who have other special skills.
Yeah.
And I'm not talking about the kids who are geniuses and
savants,
like the savants. I'm not talking about that. I'm saying a lot of our kids have other skills that no one really taps into until later, as you mentioned.
Yeah.
So some of our kids have an incredible visual artistic ability. Some of our kids have an unbelievable musical ability. Some of our kids are extremely strong with memorizing facts. Others are extremely strong with like particular topics like geography or so on and so forth. So everybody has their own skill, and unless you feed that, I find that there's a boredom factor.
Yeah.
And especially with kids who are hyperlexic or intellectually advanced, they do get bored. And when you get bored, you will, anyone, once you get bored, once you're not stimulated enough, you'll start to try to fill your boredom with something, and that something is not always adaptive.
Yeah.
So a lot of times our kids might do repetitive types of behaviors simply because everything else in their environment is kind of boring and too slow. So that's really important to pay attention to. Stimulate. That's why when a child first comes to me, I will always tell the parents, okay, we've identified all the areas of deficit that we need to work on to try to teach them to come into the average level, but what are the areas of strength? And let's look at those as well, because those are not only important to also feed, but they are the reinforcers. We all enjoy doing things we're good at. And if we don't feed that in our kids, they're just not getting enough reward from their lives.
There you go. Okay, we're saying hi to Judy too, and to Shanice. Shanice has written in and said, how to manage separation anxiety. My son just started daycare 2 days ago, and he's having major meltdowns. I want to know how Shanice is doing, because the first 2 days that you send your child to any place is hard for you, and if they're not happy to skip away from you, it's that much harder.
So hard.
I want to know if you're like laying in your car with binoculars to see what's happening.
So hard. Oh my God.
Like many of us threaten to do, right? It's hard. That's a hard time.
It's very, very hard. It's very, very hard. And you know, it's not a bad thing, I'll be honest. Separation anxiety, I mean, the positive way to look at it is that he has a very strong bond with you. And so you have to ask the teachers to kind of meet with you and to do this very gradually. First of all, you unfortunately can't really be part of it. I think you have to have good teachers who are willing to engage and entertain and make your child feel safe. You know, you can, for instance, talk to them and see if they are willing to take some object of yours that will help the child know that, you know, you're coming back. Like, for instance, the whole thing with separation anxiety, by the way, is that our kids don't know when you're coming back.
Yeah.
And they are very much afraid of you never coming back, right?
Yeah.
So you can do it in pieces. Like, you can take the child, leave them for 15 minutes, and then come back, and then gradually make that 30 minutes, an hour, etc. This will take a long time. Or you can flood the child, which means you leave them for the first day, the second day. It takes a few days, but the individuals there have to be willing to console, you know, stay close, hold his hand, have contact, do fun things that are distracting. And they have to do that for a while until the fear has subsided, and now he's able to actually pay attention to some of the things that are going on around him, and then he will begin to enjoy. But I wouldn't, you know, and for you, Shannon, is so right. Like, one of the things that's very important, and these days we have so many cameras that can help with this type of thing. Like, for you, I would suggest that you actually, like, maybe get their permission and get like a Ring camera and put it inside there so you can actually see what is going on. You can see and hear what is going on all day long. And you just want to make sure that they are doing everything they can, because nobody should be ignoring a child who's having a meltdown due to separation anxiety. They should be engaging him, keeping him very busy, and so on. And sometimes at daycare, that doesn't happen because they're busy doing other things.
Yeah.
So if that is the case, and if he's just not getting the amount of support and attention, then I would take it slow. And I would do, increase it by very short increments so that your child gradually gets used to it.
I want everybody to hear what you just said, that no one should ignore a child who is going through a meltdown because of separation anxiety.
Absolutely,
I
my
don't
God.
think people know that.
No, that's very, very important. Like they should really be paying attention to this. This is not, the function of this behavior is not to get them to, get attention from them. It's fear. They're very, very much feeling afraid, and so they should be attended to.
But you know that there's a lot of people who think the extinction thing is
Works
always
across
attention.
the board, yeah.
That it's always attention, and so you always ignore, and they think ignoring the child. It makes me insane.
Yeah.
Because you know why it makes me insane? Because it took me so long to learn what it really was.
Yeah.
And that it wasn't ignoring a child, it was ignoring a behavior.
Right.
Which is different than ignoring a child.
Absolutely.
And that you only ignored a behavior if the goal of the behavior was to get attention.
Yeah.
That took me 2 years, two solid years, because I was like, I don't get it. How come sometimes we ignore and sometimes we don't? But then when I got it, I was like, oh, everybody needs to get this, and so I'm impatient with people to get it. So we need to crochet that on a pillow. If a child is having a meltdown because of separation anxiety, do not ignore them. You give them more support. Okay, somebody wrote in and said, my son, 6, a male, I think, friend, 7 male, is autistic. I'm not sure where he is on the spectrum. And he asks me nonstop questions when he's at our house. It's overwhelming. One random question after the other. This is my new neighbor. He did this to me the other day. And his 2 grown sons and he just kept asking me questions. And I said, you ask a lot of questions. And his sons roared. They were like, oh my gosh, he totally does. But anyway, this person says, and I get really frustrated. How can I redirect the friend out of the question mode?
Yeah, so the individual asking questions is on the spectrum?
Well, first they say autistic, and then they say, I'm not sure where he is on the spectrum. So I think autistic, yes.
So sometimes people with autism will ask a lot of questions because they are trying to interact. And they don't realize that, generally speaking, in social communication, we ask a question, receive an answer, allow the other person to ask a question. There's like this kind of, it's not written down anywhere, but we all know to take turns. And that doesn't always happen, and they are curious, and they're trying to interact, and so they will ask back-to-back questions. And so there are many different things you can do. One way to handle this is just simply when the individual comes in and starts to ask questions, you just tell them right off the bat, how many questions are we going to do today? Let's do 3. And then they're allowed to ask 3 questions. Just hold your fingers up and allow them, and then say, okay, that's it, now it's my turn, and I will do that. Or you don't even have to say, now it's my turn. If you don't want to interact, you'll say, now we're going to do 5 minutes of silence, and set a timer. So it's not offensive to the end. A lot of times people don't say those things because they think they might be offending the person. You're not. You are teaching them the rules of social communication, and actually you're helping them in that sense, because then they will take that rule and apply it to other scenarios.
And I love that, you're saying that it is their way of trying to communicate with you. I think there's something about when you understand that piece of it.
Yes.
I have a much beloved member of our family that the way they reach out and communicate with people to start is by asking questions like, when is your birthday? Or things like that, because that is what they have memorized to ask. And it drives me a little crazy that there are people in our family that don't go any further than that. Like they don't volley back, like they'll just answer the question and then they don't ask the child back a question. And I pointed that out recently. I said, that's their way of trying to start a conversation with you. And I think when you realize, oh, is that what's happening? Then you can come into the conversation a lot more effectively with them.
And sometimes, and that's another really good point that you bring up, Shannon, is that sometimes it's not that they're asking 100 different questions. Sometimes they will ask the same question over and over.
Yes.
And that's, also important to point out and say, nope, you already asked that.
Yeah.
And ask me a different question. And actually asking a different question is a whole lesson that we have written up. And I think a lot of times it's just important, like I said, we don't specifically give these instructions or directions because we feel we might be embarrassing the other individual. But the truth is that if you do actually give those rules, often it helps. And sometimes you might need to write the rules down or show them with some form of visual. Like, we are going to ask 3 questions. 1, okay, I answer that. 2, okay, now it's my turn to ask a question. Those types of things. So it just depends why the individual is doing that. Often it's just because they're trying to communicate.
Is it the Vineland where you have to answer those horrible questions as a parent, where you have to sit there? Oh, I hate that test. But I remember in the beginning when we used to have to do the Vineland, and it would say, there was the one where it was, does your child, if you ask them a question, how many volleys back and forth? I don't remember how they worded it. How many exchanges back and forth, and how many words in a sentence? And I remember when the answer to all of it was not applicable because there was nothing, right? And then gradually that got added, and it was like we almost started working our way down the sheet with answers to things. And so there was a time when I remember a grandmother complaining to me about her 4-year-old granddaughter, and she said, oh gosh, she's 4, and you know what that's like. You have a 4-year-old. They just ask questions endlessly. And I went, oh,
how lovely.
Because he wasn't asking questions, right? And all I wanted was for him to ask questions. Then when he was like 6, all of a sudden there were the questions endlessly, and a lot of times it was the same question, and I had to remember, oh, I used to wish for this. But I remember the big one, we'd be driving in the car and he would say to me, what's for dinner? And I would tell him, and then be 10 seconds later and he'd say, Mom, what's for dinner? And you guys taught me to say, I answered that, asked and answered was what we eventually got to. I'd say, answered that, what else do you want to ask me? And then you guys taught me, because sometimes I would say back to him, because we were working on memory too, I would say, I just told you, do you remember what I said? And he would say, I forgot. So then what we started doing is he would ask me what's for dinner, and I would say chicken and mashed potatoes. And then I would wait a second and I would say, what did I just ask you? What did I just tell you was for dinner? And he would go, chicken and mashed potatoes. So then when he would ask me, he would say, what's for dinner? And I would say, I don't know, you tell me. And he would say, chicken and mashed potatoes. And then I would ask him a question, or I would say to him, ask me a different question. And then we got to the point where, because everybody always says, how do you get to conversation? But that was along the way.
One way, And this is a very good thing you're talking about here, because I often see that our kids, so this is another whole thing that could be happening with some of our kids. So they, remember the whole concept of prompt dependence, right? And that sometimes our kids learn that they can depend on you to give them the answer. And so when you give them an answer the first time, they don't really pay attention to it because they can depend on you to give them the answer again.
This is my husband. This is my husband.
I mean, it's a lot of us, right? A lot of people, and as time goes on, we also have learned to kind of not pay attention. We're distracted. There's a million things that distract us. So that becomes a really important thing to teach your child, is that when I give you the answer the first time, you need to be really focused on paying attention to it. And so the way that you did that is perfect, where you would give the answer and actually ask the child, what did I just say, so that they repeat it, so that they remember it. Or, I mean, a lot of times you'll just tell the child, and you can also say, now remember that. Or you can tell the child to write it down if they're hyperlexic. Or you can tell the child, I'm going to ask you that question again, so remember. You can give them ways to remember it, and that will really actually help the child in processing information. Because sometimes our kids will ask a question and they don't process the response that you've given to them. And that is, then they keep asking over and over again because they kind of depend on you to prompt it.
Yeah.
So you have to teach the child to give themselves ways to keep it in, and this is a memory deficit, right? So you're allowing the child to, you're teaching the child to expand their memory by doing various things, either repeating it, writing it, thinking about it, that sort of thing.
Okay. I love this question. Hi, thank you for the great work that you're doing. How many minutes one should give for teaching one skill in a 4-hour session? How would you decide the kid has mastered the particular skill, and how long would you keep teaching that particular skill? Do you need to revise it?
That's a very good
Woo,
question.
a lot of questions there.
It's also very hard for me to respond, unfortunately, because it depends on the difficulty level of the skill for the child. So if it is depends on a lot of stuff. I'm going to try to give you lots of information about this. So if it's a brand new skill that has never been introduced to the child before, then you probably want to give a little bit more time. Let me back up and first talk about the actual way of teaching, because there's so many different components to this. I don't want to confuse people. So when we teach a new skill, we generally will give an instruction, and as you give the instruction, you will give whatever prompting is necessary. Prompting is kind of like a thing that will make it easier. So for instance, let's say I want you to touch an object, like touch phone, and you're not doing that, and I keep saying touch phone, and you're not doing it. So next time I say touch phone, I actually touch it myself, and that is a modeling prompt. So I'm modeling for you what I want you to do, or I'll point to it. There's lots of different ways to prompt a response. So when you do that, you basically give an instruction and the prompt if you need to, and you wait a specific period of time for the child to respond, and then you reward it if the child responds correctly, okay? That specific amount of time is very important because people have different processing speeds. Some kids will respond immediately. Other kids will respond in approximately the amount of time you or I would respond, and yet other kids actually need a little bit longer to process. And that is not something you know right away. That's something you identify by getting to know that child's sort of abilities. And you can generally get to know that within like a day or two of working with that child. So first, that's my first response, is that every child has a different processing speed. Okay, now separate from that, every lesson has a different inter-trial interval. So if it's a very easy lesson, like touch your nose, okay, that's done. That will be at a certain speed, whereas if I tell you to tell me what happened in school, I'm going to give you more time. The response will take more time on its own anyway. And so the inter-trial interval, the period of time that it takes to do this lesson, will take longer. And as we go into more and more complex lessons, so, you know, receptive lessons are generally easier, like put an object in a location, touch an object, give me an object, point to an object. All those types of things are generally faster than expressive responses. So lessons that require the child to say something will take a little bit longer, because the child now has to think about yourself when you're doing a foreign language. You will receive information a lot easier and faster than you will be able to produce it. So you generally have a longer period of repetition and time when it's an expressive type of lesson, okay? So that's another aspect of it. Some children will require repetitive introduction of a repetitive or repeat of an instruction multiple times. Others will get it within 3 trials. So it's very, very different for each child, and it really has a lot to do with how familiar they are with that particular concept or what you're asking them, as well as how good they are in receiving information in that modality. So some kids will do better when it's a visual skill. Some kids will do better when it's an auditory skill. It is so hard to answer this question. The other side of that is if you see a child getting bored because something is repeated so many times, then you have to move on. You have to get to another level. How do you tell? I guess, the person asking the question asked, what's the percentage correct or something? And that, again, differs. So for some children, you won't move forward unless they are at about 90% or 95% correct on something, only because in the past you've noticed that if you move forward faster, they start to confuse topics. On the other hand, with some kids, you move forward when they're at about 80 or 85% correct, because if you try to get to 90%, you've lost their attention. So these are things you learn by working with the child. Generally speaking, though, I wouldn't move past something unless it's at least 80% correct across 2 separate days and 2 separate people. So that's kind of important, because sometimes a child will do really well with one person, not with another, and then that's either because the person is inadvertently prompting and no one's paying attention to it, or because the other person is not as good a teacher, or whatever it is. And sometimes they will be really paying attention today and not doing very well tomorrow, and that's important to know as well. So you want to have some level of consistency, so 2 days in a row, 2 different people, and at least 80% correct.
There we go.
And it's just hard, but with all that said, you always need to pay attention to giving the child new and interesting information. Our kids have a very, it's very easy to fall into repeating something too many times and getting the child to be bored.
Yeah. Well, the part of the question that concerns me is, how much time should you give teaching one skill in 4 hours? I just want to make sure that people realize.
That's important too. Let's talk about that.
I think it's important for people to realize that you're not just going to sit and drill one skill for 4 hours, even an hour, or even 15 minutes. That's not what it is.
So let's talk about that.
Yeah.
Thank you for bringing that up. So when you're teaching a child, you are never going to be working on one skill for hours. So you identify, this is why it's so important in the beginning to identify multiple areas that you need to focus on. Yeah. So let's say I do a bunch of testing with a child and I identify, okay, I'm going to start from the very beginning. Even when you start from the very beginning, there's going to be at least somewhere between, 15 to 20 different lessons that you're focused on. So some lessons are going to be based on increasing the child's language. For example, those could be receptive lessons, like, let's say I want to teach the child body parts. Okay, I'm doing these receptively, so touch nose, touch eyes, touch this, touch that. And then you're going to have multiple other lessons. You're going to have a vocal imitation lesson where the child is working on sound production. Say ah, say and so on. You're going to have another lesson which has to do with imitation. So do this, imitate this particular thing. You're going to have another lesson. So you're going to have multiple lessons, right? And each of those lessons are going to have what we call exemplars. And these exemplars are the specific item that you're teaching. So for instance, we're talking about body parts. Touch nose is a different one than touch eyes, right? Or, touch head. And you will initially start with what we call a mass trial of one particular body part, right? So touch nose, let's say. Touch nose, that's going to be on its own a mass trial. But you're not going to be repeating that for 4 hours or even an hour or even, as Shannon said, 15 minutes. All of these things are done in very, very, very small. That's why we do things like 10 trials. How long does it take to do a 10 trial set? Maybe 20 seconds, maybe 30 seconds. Then you do another 10 trial sets of something else. And that's why the child is receiving different types of information, not the same thing for so many hours. If you're doing a 4-hour session, which by the way is the longest session you should ever do anyway, Generally, sessions are something like 2 hours. And in that period of time, you're doing, let's say, 15-minute segments, okay? And you do 15 minutes of work, followed by about 3 to 5 minutes of play. Even that 15-minute segment is broken down into multiple little lessons, and in between each of those, there's lots of reinforcers. So really, the only time that you're sitting and focusing on one thing is about a minute, maybe 30 seconds to a minute, followed by some other type of thing, which is usually a reinforcing thing. Then you come back and do another minute of either the same thing or a different thing. And so there's not a lot, people talk about repetition.
Yeah.
And the repetition is important for the purposes of learning, but too much repetition can definitely lead to the child ignoring.
I really just want to make a video showing what a typical
so
session
hard.
looks like, so
It's
that
so
people, because
hard,
once you
yeah.
see it, you go, oh,
Yep.
like it's so and you can describe it, and when you see it, you go, oh my gosh, these kids
This
are having
makes
a
sense.
ball and they're learning and they're having a good time,
But
and
that's
it's
the-
fast paced and it's
Absolutely,
moving.
it's fast-paced and fun, but that's why we tell people to always have about 15 to 20 lessons.
Yes.
Because you won't repeat.
Yes. Yes. I want to say, Poker King, welcome back. We haven't seen you in a while. Really quick question. He wants to know, sparkling water is good for you or just regular water? Poker King has written to us before about drinking a lot of soda, and now he says he's lost a bunch of weight not drinking soda. Do you have a preference for our kids?
I
about
honestly don't
sparkling or-
know. I mean, sparkling water generally is mineral water, so I
Now
don't.
they have all that seltzer
They
that
have
it
all
isn't.
different kinds of
It's
seltzers
flavored
as well.
and
Yeah.
things.
Honestly, I have no idea. Maybe ask a nutritionist if they have an opinion on it.
We love bubble water in our house.
Yeah.
That's what we call it, bubble water in our house. But if you're gassy,
Yeah,
then there's
exactly.
that.
Yeah, and someone else, did you see the question before that about zeolite?
I did. I didn't know if we wanted to go there.
I'm just not going to give an opinion on that because it's one of those things that I don't know enough about. It is for the purpose, it's supposed to be for detoxification. But from what I know, it has silicone and aluminum, and I don't know. I just don't know. I'm one of those people that always wants to see a lot of research on something before I can say one way or another.
I mean, it sounds to me like it's a chelating agent, and if you're going to do chelation, I think you need to be under a doctor's care, in my opinion.
100%,
I've seen kids get injured
100%.
not doing that, so
Yes,
I'm just going to say
agreed.
that. Fortune, I want to get to their question. Hi, doctor. My daughter is 4 years old and 1 month, 4 years and 1 month old. Was diagnosed with moderate to severe autism, towards the more severe side. She's nonverbal. One word, kids with major tantrum and hitting, biting. She's not social. Should I focus on ABA 40 hours a week, or should I do 30 hours of ABA with 10 hours a week of socializing with kids? She is ID smart, knew her ABCs before 2, could write ABCs before 3, and up to 100 in numbers. She has great memory. Can she recover? Is 4 years old too late to start ABA? And blessings.
Okay, I would, and she's 4 year 1 month, I would do 40 hours of ABA, and I would not worry about social until she has a little bit more ability to communicate. It's very, very hard. We expect our kids to socialize when they can't understand or express. So really focus on trying to get her language up. And remember, you have more than 40 hours of awake time. So even if you're doing 40 hours of ABA, you still have 10 hours.
Lots of time to
You still have
socialize.
the 10 hours to expose her to other kids. But I would really focus on skill teaching right now more than anything else. And I would do that for the next year. And then you can start to you can certainly have her be around other kids, no question about it. But you'll see that good ABA is so vital, and there's so much to learn that you should be spending that time doing that. 4 is not too late. It's good. You're fine. Don't worry. And she is tantruming, hitting, biting because she can't communicate. Most of the time, those types of behaviors are communication. The child is trying to say, don't, leave me alone, give me something, I want that, I don't want that. They're expressing themselves through these behaviors. A good ABA person will teach them to use language instead of those behaviors, those challenging behaviors, and things will start to change. This is the time where you just need to really focus, and please don't be afraid or like think, oh, time has passed or anything like that. You're doing the right thing. Get them into ABA, and you'll love the journey. Just stick with it.
Do what she said, 40 hours, you won't be sorry. Judy, I love Judy's thing, Dr. Doreen and Shan, thank you, great advice and knowledge. Wish I could bring you both to my home for my 2 autistic grandchildren. Love you both. Judy, tell me where you live. I'm not promising anything, but tell me where you live. That's all the time we have for today, and yet
I
know, and I just so enjoy this. And I hope that you guys do too. Thank you
such a pleasure. I can't. Honestly, I looked at our clock at I thought it was like 10:15, and the next time I looked, it was like 10:40.
I know, it flew by. It flew by.
Yeah.
We were gonna announce something today, but I didn't talk to you about it before. Do we want to announce it or not?
I don't have a name.
I don't have a name for it yet. But what we're talking about doing in April, do we want to reveal that now or
sure,
wait?
Why not?
Well, I just want to say to everybody, we've been talking about this for a couple of years, but we've decided to do it this April. We are going to do a 44-hour-long live podcast.
Marathon.
We're going to get on the air, and we're going to stay on the air for 44 hours.
Very exciting.
So it's going to start on April 4th, and it will end on April 6th. I will be stupid tired by the end, but that's okay. Hopefully I'll keep my language under control. I tend to swear more when I'm tired. We'll try not to do that. But we're going to have lots of guests. So mark it down in your calendars. The 4th through the 6th of April, we're going to do something wild and crazy, and you're going to get more Ask Dr. Doreen than you've ever gotten before. She will not be on the whole 44 hours.
No, but I'll be on a lot, and it's exciting.
Will be on
I'm very excited about it.
And we're going to have a lot of guest organizations coming in to help us to do the 44 hours. So you heard it here first. Well, you're going to be hearing much more about it. 44 hours live. It's wild, crazy, and I'm scared. But they say, do the thing you're afraid of, right?
Absolutely. And if our viewers have particular guests or topics, let us know, because we'll work on it.
Yes, we're making the schedule now. So I want to let you know that tomorrow we're here with somebody who's written a book recently. They're going to be talking about teaching reading comprehension.
Oh, wonderful.
Which will be wonderful. So that's tomorrow. And then on Thursday, it's Let's Talk Autism with Shannon and Nancy. Nancy also, Spa Jackson will be here. We've got a total of 3 great guests that are going to be here for you. We're going to have somebody from an arts organization talking about the role of arts in autism. And of course, I've drawn a complete and total blank on who the other 2 guests are. Can you tell I'm getting old? I used to be able to steel trap and I could remember all of it. But I know they're amazing. Oh, no, you know, I know what it is? It's somebody who is changing how we teach how to play with children, especially on the spectrum.
Oh,
so we're going to love that. That will be really good. And then Friday, of course, we have Stories from the Spectrum. Great video.
Awesome.
Especially one from a young man talking about teaching eye contact from his point of view as an adult. So tune in for that, but we'll be back tomorrow. Until then, give your kiddos a hug from me and one for you too.
Bye, everyone.
Thank you, Dr. Granpeesheh.
Thank you, Shannon.
Bye-bye for now. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.